My name is Michael Savell. I'm a family nurse practitioner student at Auburn University. I want to speak to you briefly today about the past, the present, and the future of the role of the nurse practitioner in America, what the nurse practitioner means to the American healthcare system, and what the nurse practitioner can do for you. The nurse practitioner has been involved in American healthcare since the early 1960s. Nurse practitioners were first recognized as nurses helping in primary care when patient populations began to overwhelm the amount of doctors that were available to care for their needs. By the 1970s, the U.S. Secretary of Health Education recommended that MPs serve directly as primary care providers. This was also to help out with growing patient populations and a decline in the number of doctors that were available to care for patients. By the early 1980s, new educational requirements and a national certified exam helped to legitimize the nurse practitioner as a provider role and encourage nurse practitioners to move forward with their education and to progress in patient care. By 1997, Congress had approved Medicaid and Medicare reimbursement for nurse practitioners. This helped to legitimize the nurse practitioner even further, as they could now bill for their primary services in the provider setting. Nurse practitioners became accepted members of the clinical community by the early 2000s, and today the role of the nurse practitioner continues to grow and adapt to the needs of the American healthcare system. Today's family nurse practitioners are caring for millions of Americans. Year in and year out, patients are visiting family nurse practitioners because of a 4 to 5 decade worth quality track record of delivery of care and quality service. Now, more than 80% of the nurse practitioners that are graduating accredited colleges and universities are finding themselves working in primary care. They work in family, adult and geriatrics, women's health, or pediatric roles. The requirements for education for this type of degree is now 6+ years of academic preparation and field studies. The nurse practitioner today has a 4-year degree with a Bachelor's of Science in Nursing, another 2-year degree as a Master's of Science in Nursing, has passed a national certification exam, and keeps a state registered nurse's license. Today's nurse practitioners see a great deal of patients because of the decline in the medical provider population in the current health system. Overpopulation, aging baby boomers, newly insured from the Affordable Care Act, all put intense requirements on primary care providers. Fortunately, the preparation of the nurse practitioner allows them to see 2 to 3 patients an hour and helps to provide primary care. 2 out of 3 patients support increasing legislation for greater access of MP services and improving the amount of nurse practitioners that are available to care for patients. The role of the family nurse practitioner will continue to evolve in the future. With continued success in primary practice, nurse practitioners are going to earn themselves increased autonomy in practice. In a recent study done by Marston and Street, they found that nurse practitioners in primary care were actually having greater success than the primary care physician when talking about chronic disease management and things like patient education. They found that this was actually leading to better overall management of the patient and actually better overall health for the patient. Marston and Street actually go on to suggest that with the success of this holistic model, that the patients of the future will actually seek out nurse practitioners in primary care in order to get the best health care that they can. Another change in the horizon for family nurse practitioners will probably have something to do with education. There's already studies out there. One's done by Mary Berman and a few other people. And in this study, they have basically stated that they think that the model for education for the nurse practitioner needs to be completely overhauled. In their mind, that the traditional pharmaceutical and medical model needs to be changed to a more holistic model of care that focuses more on health behavior changes, exercise physiology, and nutrition and other things like this that encompass the total patient and not just a medical problem. FNPs can also expect increased pressure from other members of the healthcare team. As the needs of society continue to change and patient populations continue to increase and the number of doctors that are available to see these patients continues to decline, family nurse practitioners are going to have to step into this role, and they're going to have to take responsibility for patients, and they're going to have to deliver patient care to the utmost of their ability. There are many professional organizations out there today for nurses and for advanced nurse practitioners like the FNP. These professional organizations are great for family nurse practitioners because they establish a certain level of values. They do the same. They establish and maintain integrity in practice, and they promote social justice amongst NPs in the nurse practitioner profession. These professional organizations also promote growth in NPs. They do this by allowing new nurse practitioners to get socialized, and they give them experiences at different things like conferences and other types of gatherings and mentoring with experienced nurse practitioner. So this allows the new nurse practitioners to grow and develop by using the knowledge of the people that have been there before them. The professional organizations also set certain competencies and standards for practice, and these competencies and standards allow for professional growth and excellence in standards of care. Basically, they standardize care across the board, and they ensure that patient satisfaction stays high and that the patients of the future will be cared for as well as the patients of the past. I want to leave you with a few main takeaways. The first takeaway is that the nurse practitioner is not new. Nurse practitioners have been around for well over half a century now in patient care. The second takeaway is that nurse practitioners can be found everywhere. Nurse practitioners are not strictly in rural areas or urban areas. Nurse practitioners are currently in all 50 states and the District of Columbia taking care of patients in the primary care setting. The third takeaway is that nurse practitioners can examine, they can diagnose, they can treat, and they can manage chronic and acute healthcare conditions from pediatric to geriatric and across the lifespan of the adult. The fourth takeaway is that nurse practitioners are very educated. First off, nurse practitioners are RNs at the bedside. This is where nurse practitioners learn patient care. Nurse practitioners are then required to at least get a BSN, which is a 4-year science degree, followed by a 2-year master's degree in science in order to qualify to sit for a national certification exam. The fifth takeaway is that nurse practitioners have a very strong foundation given to them by professional organizations that provide professional guidance, ethics, and mentoring. These organizations are what strengthen nurse practitioners and will provide for more autonomy in practice for the nurse practitioners of the future. Thank you. This has been a public service announcement.